Let me know when, and I'll say hello. Okay, got it. Hi, everybody. Welcome to tonight's presentation of Your Space, which is a real collaboration of the City of Hamilton Public Health Services Division, which includes Child and Adolescent Services and Hamilton Family Health Team and Parents for Children's Mental Health. We also have a little bit of extra support from Linwood Charlton Center as well. So thank you for joining us tonight. Thrilled to be here and sharing this information with you. Okay, let's move along to the next one. Thank you, Haruka.
Okay, good evening, everyone, and welcome. Before we start our session, we'd like to recognize the land where we live, work, and play. So we're journeying across from Ontario on Indigenous lands that always have and continue to be inhabited by First Nations, Métis, and Inuit peoples. Indigenous practices of health and well-being have been in place in this territory for over 10,000 years and are maintained to this day. As settlers, we're grateful for the opportunity to be here, and we thank all the generations of people who have taken care of this land for thousands of years.
Thank you, Andrea. And so before we get started, I just want to welcome everyone and share a few notes about today's session. There is an opportunity for you to share your questions in the chat if you're in Zoom or directly through Facebook Live, and we'll pick those up and respond to them. Dr. Steen and Lauren will be, of course I'm coughing now, we'll be able to respond to questions that were submitted in advance and share information about that first. And we are recording today's session, but towards the end, if you have individual or unique questions, we'll be stopping the recording and enabling people's microphones if you'd like to jump on and share questions that way. And any young people or families that may want to have a conversation and get some peer support, you're welcome to let us know. My name is Louise, and I'll be offering peer support for families, as well as Jennifer Layton, who is one of the PCMH Hamilton's co-leaders, and Haruka Kanai is here to provide support for young people. And the recording will be posted to the Your Space website, and there's lots of information on the City of Hamilton's pages, and we'll make sure links to all of that are shared later. We do want to remind everyone that when we do have shared conversations in spaces, we encourage you to, follow these guidelines. We really do hope that you will, if you're going to share any comments in the chat or later with your microphone. And this is just to help everyone feel comfortable and protect privacy. And in particular, today's session is open to young people and families, and we just always want to remember and be kind and think about who we're here with today. So we do encourage you to be curious and ask all the questions you'd like, and to be wise. Really encourage you to not name any people or places that are connected to you in your life that may identify you, if that's a concern. And please do choose your words with kindness. And any comments that are shared that are hateful, oppressive, or explicit will lead to being blocked from the session. And of course, take care of yourself and others, and know who's around you and who's comfortable with what's happening and what we're talking about, and know who you can contact for help or support if needed. And this session is being recorded for sharing later, but the chat will not be part of that recording. So we do request that you're a good digital citizen and not record, capture, or share any of the other content that's shared by participants. Okay, that's our housekeeping. I'm going to hand things over to Sharon. Is it you now? Yes.
Yes, thank you. Welcome everyone to the Q&A session this evening. My name is Sharon Munn. I'm a health promotion specialist at the City of Hamilton Public Health Services, and have helped to coordinate this session this evening. We hope that you get the information that you need to help make an informed choice about vaccination. We recognize that it's a difficult decision for some, and the main goal of tonight is to provide information and get your questions answered. Next slide, please. So there's a variety of people who have worked together to make this session happen. And we're just going to let Dr. Rebecca Steen and Lauren Hawthorne introduce themselves in that order. And then I'll give you a few stats about vaccine right now, and we'll get started. So Dr. Steen, would you like to introduce yourself?
No. Hi, I'm Rebecca Steen. I'm a family physician in the city of Hamilton through the Hamilton Family Health Team. And I've been an active participant in the COVID vaccine clinics and the COVID assessment clinics as well.
Hello, everybody. My name is Lauren, and I am a social worker and a clinical therapist at Child and Adolescent Services for the City of Hamilton. We work within public health with kids that are under 18. In addition to doing that work, I myself am a needle phobe, so I'm excited to be here tonight and talking about vaccine hesitancy and answering questions.
Great, so thank you very much. How the session will work is I will be asking the pre-submitted questions. First, the first set of questions is for Dr. Steen, followed by a few for Lauren. And I'll just give you some updated statistics from today. So right now, Hamilton is sitting at 85% of the eligible population. So those born in 2009 or earlier have received at least one dose of their COVID-19 vaccine. And we have reached 80.9% of the eligible population with 2 doses or fully vaccinated. So our numbers are rising, but there is still some work to do. And that's the intent of this session, to help provide that information. So the next slide is the first question that was submitted. And I think it's a good starting point. So how do COVID-19 vaccines work?
Okay. So I think it's important to recognize that vaccines are a way that your immune system develops antibodies to a virus without getting the virus. So it's a much safer mechanism for your body to develop immunity than actually catching the virus, such as catching COVID-19. And you cannot get COVID from the vaccine. That's another common question. The COVID vaccine is made up of mRNA, and that's the mRNA, in case you don't know what that stands for, is messenger RNA, which tells your body to produce a protein when it enters your body. And that protein is the spike protein. So if you remember we've seen too many pictures of the COVID virus with the spikes on the outside. And it actually makes the little spikes on the from the outside of the virus. So it doesn't actually make the virus, it just makes a component, has your body make a component of the virus. Your body sees the spike proteins and knows that it shouldn't be there. So develops antibodies to those spike proteins. And in that way, your body develops immunity to the COVID virus. So that if in the future you were exposed to the COVID virus, you already have the antibodies to it, so that you do not become or infected, or your infection is much less severe. People will have questions: what happens to the messenger RNA that goes into my body and tells it to produce this protein? It breaks down after it has told the body to produce the protein. It is then broken down by the body within about a very short time frame, normally within a week. And you then don't have any further of the mRNA, so it doesn't stay in your body forever. It just gets degraded. So it's not incorporated into your body, it doesn't stay in your body, doesn't change your DNA, doesn't change any part of your body permanently. It gets degraded and it's gone.
Great, thank you. And the next question that was submitted, is about safety and efficacy. So are the COVID-19 vaccines safe and effective for youth, but this could also apply to just the general population as well?
Yeah. So the COVID-19 vaccines are actually very safe and effective. People worried that it was a new type of vaccine that hasn't been used before, but this type of the messenger RNA technology has actually been used for a long period of time in cancer treatment, and has been researched in that field for over 10 years. And there was actually a previous vaccine developed for the rabies virus with mRNA. That was shown to be effective as well and safe. Honestly, the reason it wasn't mass produced and utilized was because there was already a vaccine on the market, so there was no point. So it didn't come into usage for that reason. The other reason that people are concerned about the vaccine is because it was developed in, I'll put it in quotes, a short period of time. But when you look at the research was actually done globally by many international researchers, whereas normally a vaccine is being developed in one lab in one country by a few scientists. This was the world working on a vaccine all at once, which is significantly different and means that it can get developed more, it can actually get developed more quickly because more people are researching it. But it's also that the technology that we have is more advanced, and there was much more funding for people across the world to be working on these vaccines. And the approval process that the vaccine actually had to go through Health Canada has not been different than it would be for any other medicine or vaccine. The process was still just as stringent. The one difference was that when the COVID vaccine came forward to get approved, most of the time medicines are in line. They've put in their application and they're in line for Health Canada to go through the approval and look through all of the studies and the information. The COVID vaccine jumped to the front of the line. Everyone was looking at the vaccine and its approval. So it didn't have that wait time, which made also a significant difference in the time it was to be approved. And the vaccine was also being produced at the same time as the trials were running on the vaccines, so that when the vaccine was approved, it was ready to be distributed immediately, which is normally when a company is creating something, they wait to produce it until they get approval. So those that was a significant difference in its production. It's been trialed on over 70,000 volunteers. That has been across a broad section of people as well. So 35 to 40% of the participants were Black, African-American, Latino, Hispanic, and that was in both the Pfizer and Moderna vaccine clinical trials. And we know from the studies that the vaccines significantly lower your risk of severe illness. They can lower your risk of contracting COVID, and they lower your risk of hospitalization with the illness. The Delta variant that we have right now, our vaccines are still very effective against it. Which is very important because the Delta virus is cause more severe disease and more hospitalization, particularly in young people who were younger, which wasn't the case with previously. For an idea behind the number of how effective the vaccine is, someone who is unvaccinated is
Great, thank you. And the next question submitted is, what are the vaccine ingredients?
Okay. Kind of like a recipe, ingredients. The COVID vaccine, let's first start with what they don't have in them. There's no eggs, there's no animal byproducts, so there's no gelatin or pork. It's gluten-free, it's latex-free. There's no antibiotics or aluminum in it. People worry about aluminum. There's no aluminum in it, and there's no preservatives in it. What the vaccine does have in it is the messenger RNA. It has a fat layer that coats the messenger RNA to protect it, well, so that it can be injected into the body. And then it's suspended. So the liquid that it's suspended in is a combination of sugar, salt, water, and what people will have heard called PEG. PEG has become something that all of a sudden everyone knows about because it's in the vaccine, but it's actually been in lots and lots of products that you've always been using and just never known it was there. It's a base in most skincare products, most lotions and creams. It's in toothpaste, it's in makeup, it's in some foods and drinks. It's in some laxative products. People have heard of Restoralax, that's one of them. So while it's come to be known to people because of the vaccine, you've been using it for years and years and years. It's in almost every cream that you would put on your body. So it's very, it's been around a long time and a very safe product. There's no blood products in it. There's no fetal cells in it. There was a concept that there somehow this was developed that way. It wasn't. There's no human product in it at all. And if you had questions about the list of the ingredients, you can actually go on the Health Canada website, and they list the ingredients for all vaccines. So you can look there if you want more detail.
Thank you. And a lot of different religious organizations and groups have put out messaging on how the vaccines are religiously permissible, with some neat graphics on social media and things like that as well. So that's great. Next slide, please. So what are the potential short and long-term side effects of the COVID-19 vaccines?
Okay, so the short-term side effects are really similar to basically any vaccine that you would get. They're short-lived. They're normally within the first week. They're normal. We actually expect people to have a few side effects. The side effects actually tell us that your body is mounting the immune response. So the type of side effects that people will have are tiredness, a bit of headache, you might feel some muscle or joint pain. Some people have fever. And this isn't because you have an infection. This is because your immune system is creating those antibodies and mounting the immune response.
Don't get scared, Joel. Why are you getting scared? Don't get scared.
Okay, you can continue now. Thanks.
People can have chills. These normally the first day people normally feel fine, and this would normally start, after 24 hours. It's rare to have feel extremely unwell with the side effects. Most people can manage these with Tylenol or Advil, fluids, taking a nap, which is what I did. And with any vaccine, it's significantly more common to have short-term side effects than anything long-term. As part of any vaccine, and this is any vaccine and actually medication that comes out onto the market, Health Canada has a very stringent, I'll call it watchdog on products. And there are weekly reports on the vaccine safety and side effects or potential adverse reactions that have occurred. Go to are reported to Health Canada, so they do very, very careful monitoring. Many people have heard or read about the rare cases that can occur from the mRNA vaccines of a potential inflammation of the heart, or the lining around the heart. This is called myocarditis or pericarditis. It needs to be noted that this is extremely rare. It is, you wouldn't have it and not know you have it. Most of this would occur in adolescents and young adults. It's more often in males than females, and more commonly after the second dose, and more common in the under 30 age group. However, and it's normally within the first week of having gotten the vaccine. It would be very rare for this to, or I myself have not heard of any cases past a week. And this particular type of inflammation of the heart is mild. It's treated with anti-inflammatories and resolves on its own, actually normally within a week with anti-inflammatory treatment without any long-term consequences. And the Canadian Pediatric Society and the Canadian Cardiology Association, I believe that's the right acronym, still are advising that this is a rare complication and are still highly supporting that everyone get the vaccine because this is very mild and it's very treatable. The other thing to note is that viruses can give you pericarditis and myocarditis, and viruses such as COVID can do those things and cause multi-system organ inflammation. So that's an important comparison.
Thank you.
Okay. There was just one more comment on that, is that the Pfizer vaccine is actually shown to have a lower rate of this, and that is why the younger age group is vaccinated with Pfizer.
Yes, absolutely. And the next question that was submitted. So from your experience as a family physician, how would you respond to patients who were asking about safety of the vaccine with their own medical conditions? So if someone had asthma or diabetes, is there a higher risk? Would you still say that they're safe for those individuals?
So I would actually say for those individuals that the vaccine is even more important to get. So there is no increased risk with those individuals with the vaccine. They may have the same side effects as anyone else right afterward, feeling a little achy, a little tired, myalgias, but they do not have an increased risk of those side effects or worse side effects after the vaccine administration. But why I would say it's even more important for those people to get the vaccine is we know that conditions such as asthma that affect the lungs, or if you have a condition that affects the immune system, that if you get COVID, you're more likely to get more unwell and sicker with it. So that is why it's actually safer to get the vaccine.
Great. I think that's an important thing for everyone to hear. And we get a lot of questions in public health with people's personal health information. And we always recommend speaking to your own healthcare provider if you have one, because they would know your history best to help answer some of those questions.
And there really are very few people where the vaccine is actually contraindicated. That would be for someone who was allergic to absolutely everything in either of the vaccines, which would be very uncommon. And the second reason, and this is only to actually delay the vaccine, is if someone has had myocarditis with the first dose, or has had a recent episode of myocarditis for another reason, like they've had another virus. The recommendation is delaying the dose, but it's still not getting the dose.
Right.
Yeah.
Thank you. And the next question is, why is it important for youth to get vaccinated? So we sometimes hear like it's not important for my child to get vaccinated, or it's more important for older individuals to get vaccinated. So as a physician, what is your response to that?
So herd immunity involves the whole herd, and it doesn't matter your age. And it's important for a number of reasons. The first being that while most younger people don't get severe illness with COVID, some do. And they can be very unwell with it. And we're seeing that more with the Delta variant. So that's a concern. And the other concern is Delta's not going to, there's variants past the Delta variant. We're going to have other variants. And we don't know if younger people with different variants might get sicker with them. The other issue is that a young person can transmit the COVID virus to someone who is older or unwell. So your child doesn't have any medical conditions, but your child transmits COVID to another child who has asthma, who maybe is more at risk with COVID. And the vaccine is effective, but it's not 100% effective. And we know that vaccines are more effective in communities where the vaccine rate, we talk about herd immunity, where there is a high vaccine rate, and it's because the transmission goes down within the whole community. The third reason that it's important that everyone get vaccinated is that if the virus can spread from person to person, that's when viruses mutate. That's how we get variants. And so if children are spreading amongst children, even though they may not get that unwell with it, that gives that virus a chance to mutate and get another variant. And if we get more variants, there's more chance that the vaccine that we do have is not effective against it. So it's very important that we get control of the virus now for everyone.
Absolutely. Thank you. And the next question, I think your experience working in some of the vaccine clinics will help. So can youth provide their own consent in these clinics? And so we're talking 12 to 17-year-olds here.
Okay, so in medicine, youth can provide their own consents, and that's with any like if they come in for a vaccine in my office or a medication in my office, or a vaccine. So that doesn't just apply to the vaccine clinic. This applies to youth in general. They have to be able to make a decision, which means that they have to be able to understand the treatment, why we're recommending it, and the risks and the benefits, okay, and the potential consequences if they don't get the treatment. And then the individual who is giving the treatment or giving the vaccine has to determine if they feel that that 14-year-old understands the information that was given and is capable of making the consent without their, we'll call it the substitute decision maker, or their parent or their guardian, or legal guardian. So they just have to be capable of understanding the information.
Thanks. And I think that's a good consideration, that it's not just this vaccine that this consent issue has come up from.
Mm-hmm.
Perfect. And the next questions were submitted after vaccination. Do I need to continue to follow public health measures? Can I visit with vaccinated friends indoors?
Okay. Fantastic question. So everyone still needs to follow public health guidelines, because when you're out and about in the community, you don't know who's vaccinated or who's not vaccinated. And to prevent the spread, then we still need to follow public health measures. So those public health measures, good hand sanitizing, wearing your masks, social distancing when if able. There are changes to the recommendations for people who are vaccinated versus unvaccinated as far as your ability to meet up or have friends to your house or be at a gathering. So currently, with the Ontario guidelines, if you're having a gathering indoors, the maximum number is 25. That if people are fully vaccinated and feel comfortable, they may consider removing their masks. There may be people in that environment who still do not feel comfortable to remove their masks. However, that is advised that they can consider it. People from multiple households who are unvaccinated or partially vaccinated, or you don't know if someone is vaccinated, you need to wear a face covering and physically distance when you're indoors. And that's why at any at venues, like you're walking through a mall, you have to have a mask on. You don't know who's who. And that's how to prevent transmission. And my little key point here, having a mask on means that the mask is covering your nose and your mouth. The mask is completely ineffective if it's below your nose. So it needs to cover both your nose and your mouth. Still, if you're feeling unwell, even if you've had the COVID vaccine, don't assume you don't have COVID. It's still recommended that people, if they have COVID symptoms, even if they've been vaccinated, get tested. And you shouldn't be around other people if you're feeling sick. I would say that this should be a recommendation irrespective of whether we had COVID or not, that you shouldn't be around other people if you're feeling sick to give other people other germs. And virtual type events are still the safest events, followed by outdoor events. And that's just because of the ventilation. Less people, less risk of COVID. And if you are indoors, making sure ventilation is good. So if it's good weather, opening up the patio door, having this, the screen door the doors open so that or the windows open so that there's good ventilation.
Thanks. Yeah, and I think that's a question that many people have right now, trying to navigate how to return back towards normal, whatever that is, in the context of public health guidelines. And these guidelines do change and will continue to change. And that's just something that everyone needs to be aware of. And it will depend on hospitalization and case numbers in the community and things like that. So always
if there's
following.
variants, and if there's new variants that we're not sure of. So
yeah,
those will definitely, and in the wintertime when we're indoors more, these guidelines may change again if we're seeing a peak in numbers.
Yeah, so that's something just everyone should be aware of to watch out for, and you can get that information from your local public health unit. The Ontario Ministry will have up-to-date guidelines for you. So thank you, Dr. Steen. That's the end of your questions that were pre-submitted, and we have 3 for Lauren. And so I'm going to get Lauren to answer the first one. Can I have someone accompany me to get my vaccine if I am nervous?
Okay, so if you are nervous, you can absolutely have a person with you to support you. Just ask ahead of time, have that person join you. In particular, if you have a pretty big fear of needles and it's getting in the way of your ability to be vaccinated at a vaccine clinic or with the rest of the people in your family, you can always contact the Extra Support Clinic. This is a really cool resource that I didn't even know about. The Extra Support Clinic runs out of Hamilton Health Sciences, and they have the ability to support people who have a fear of needles, who have autism, sensory issues, and those people who need a little bit of extra comfort and a trained person who can help be compassionate and empathetic and support them through the process of vaccination. So yes, bring someone along with you or contact the Extra Support Clinic at HHS and have one of them guide you through the process. Those folks are experts at it.
Perfect. Thank you, Lauren. And the next question is surrounding needle fear. So I'm afraid of needles. What are some coping strategies that I can use?
Oh, me too. I hear you. I was terrified to get my COVID vaccine. In fact, I'm terrified to get every vaccine, flu shots, everything. And so my heart goes out to people that are afraid because this has been, quite a long time of us talking about needles, about injections, and the importance of vaccination. So if you're afraid of needles and this information is everywhere, wholly overwhelming. So, in terms of coping strategies, first, I'd like to speak to parents who might be attending this or watching it later on. If you have a child or a youth who is afraid of needles, one of the most important things you can do is to validate this fear, to hear them, to be empathetic, and to be supportive. The reason I say this is that when we are dismissive of someone's fears, or whether we reject them as being unimportant, insignificant, or we tell them that's not that scary, get over it, we are in effect making them feel kind of small. They might feel silly, they might feel ashamed, and their fear might actually grow, only they're not sharing it with us at that point. So when people are feeling small, silly, ashamed, they're not feeling their bravest, they're not empowered. That's not what we want our kids feeling when they go into an appointment. Instead, we want them to feel really empowered. So we want to validate their fear, let them know that it is scary, that this is a big decision, that we know people have worked really hard on, that we've got lots of research for, and that we've decided is best for our family. We want you to communicate that your child is capable, they are powerful, they are brave, and even though this is scary, they can do it. We also want you to communicate that they're safe and that they're cared for by the doctors as well as by their family members. So they're supported through this process, they aren't alone. The next kind of coping strategies you can use the card method. So this is just an easy way to remember 4 simple steps of comfort, ask, relax, and distract. And you can rely on a parent to do these with you, or you can do them for yourself. So the first is comfort. When we're going to do something that's scary, what we want is comfort. So wear something comfortable. Bring a soothing item with you. You might choose to lay down or sit up, to sit on a parent's lap, to hold their hand. If you're with a parent, they might choose to gently stroke the child's head or their arm, and provide a kind of sensory input that can be soothing for the child. The next one is ask, A. So you'd like to ask for what you need. This is so hard as patients and clients. We really have a hard time advocating for ourselves, and that's something that's really important. And so if you'd like to have someone with you, ask for it. If you'd like to have privacy, ask for it. You can also, you know, ask for your phone to have music or a distracting game. You might ask to have pain relief. You might talk to your doctor about that, some kind of topical cream. You may also ask your doctor, can you walk me through the process? Can I watch? Or can you not show me at all? I'm not going to look. And so having that kind of conversation, advocating for yourself, it can make the process a little more comfy. The next one is to relax. Easier said than done. Absolutely. If you're terrified, how are you relaxed? I don't know. But there are some things that you can do to lower your heart rate and to calm yourself down. And the first one is to breathe. So hard when you're afraid. And so we need to be really mindful and intentional about our breathing. We're going to ask that you take in breaths through the nose and deep out breaths through your mouth. We're going in and out, nice and slow. When we slow down our breathing, we can actually slow down our heart rate. And that can be essential in keeping us conscious and feeling good when we're having a vaccine. Something else you can do is focus on relaxing your limb. So when you're getting an injection, the last thing you want to do is make a big, strong arm. Instead, you want to be loose like spaghetti. You want to be nice and relaxed. The other thing you'd like to do is maybe provide yourself with some soothing messages. So positive self-talk, nice and relaxing voice, telling yourself that you can handle this, you can do this, you are brave, you are safe, this is the best decision for you. That kind of positive self-talk goes a long way, I promise. The last one is to distract. So you may rely on a family member to help distract you. For instance, my mom and dad always used to say, "What does that sign say over there? Can you read me that fine print?" And before I knew it, I had my injection. Something else you might want to do is, chat about what you learned that day, or the friend you're seeing later, or your plans for your Halloween costume, what your birthday present might be, that kind of thing. So getting up in your brain, using those thinking thoughts, and using it to kind of distract you from what's going on around you. The other thing that you can do is muscle tension. This one is really great because you can do it on your own. And so, muscle tension, it helps us to stay conscious or to not faint when we're getting needles. This is something that's really, really helpful. And so, really simple to do. What you're going to be doing is sitting in your chair waiting for your vaccine, and you're going to tense your tummy muscles or your leg muscles, and you're going to tense them really, 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 really tight, 10, 15 seconds. You might notice your face gets flushed, or you're like, oh my gosh, it hurts. At that point, you let it go, nice and soft. And then you repeat the process. And you're going to do this over and over and over again, focusing on it, focusing all your attention on that tension so that the doctor can give you your vaccine and you can stay conscious and it will be over before you know it. So we're concentrating, we're distracting through concentration and muscle tension. So I hope that those are some helpful coping strategies for both family and for youth themselves to get through some difficult vaccine challenges. I know you guys can do it.
Thanks, Lauren. And the final question that was pre-submitted for you, Lauren. How can I help my child who has anxiety about unvaccinated individuals in our family? So how do you deal with those difficult conversations?
Such a difficult conversation and a big kid worry. Like this is a tough thing to realize that our youth are dealing with. And so I think having the conversation in the first place, fantastic thing. And what I would kind of recommend is that we, again, validate the fear that yes, COVID-19 and the idea of people being unvaccinated or spreading germs, that's a really scary thing. And it's this threat that's kind of existential or intangible. We can't see COVID-19 on our hands. And so it becomes this kind of scary thing. and letting our kids know that it's okay to be anxious about that. It's okay to be worried. And then to kind of shift or redirect towards what they can control. So we can't control whether the adults in our lives decide to get vaccinated. That's outside of our control. What is in our control is following public health measures. So if your child is particularly anxious about being in public spaces, maybe it's about making sure they have a medical grade mask, or making sure that they have their own hand sani that they keep on their backpack, about keeping 6 feet, and also maybe helping them prepare a statement for when they'd like people to keep 6 feet from them. So excuse me, can you please give me my space? Or please social distance from me right now. And helping your child feel like they can advocate and ask for what they need. Those are the things that are within their control, and that's what we really want to focus on. Difficult conversation, and one that we want to approach with empathy, validation, care, and as much control as possible.
Thank you, Lauren. I feel like there's been a lot of difficult conversations in this last year and a half. So before we open it up for any additional questions that may have come in through any of the chats, there's one more slide. If anyone is looking for additional information, I would guide you to hamilton.ca/COVID vaccines as a good starting place. From there, you can go to our vaccine information for youth page, where all of the information for vaccine for 12 to 17-year-olds can be found. There is an FAQ section with an extensive list of FAQs, and these are updated as information changes. So for example, this past week, we've added new information about pregnancy, infertility, vaccines in breastfeeding individuals, as there are more, as there's more data, or as there is new messaging from the ministry or new statements from different physician groups, we update the information. So we try to keep it as up to date as possible. You'll also see all of the clinic locations that are coming up, and they're normally posted for like about 2 weeks. So you'll see what's happening in the next 2 weeks and in which areas of the city you could get vaccinated if you choose. And the majority of the vaccine clinics accept walk-in. So there isn't the need to book an appointment unless that's something that you would like to do, and that's still available. And you can find information about needle fear and coping. And this is found in a couple spots, but one of them is on the youth page. And then other information. So reach out to your healthcare provider for getting some additional questions answered. Ontario Ministry of Health, local public health units. There's lots of information out there, but we just want to ensure that you're looking for reliable information. So maybe not through social media, or if it's something from social media, then validate it and go check where that came from, and try and go to your local public health unit first and see if that information is correct. So I'll pass it over to Andrea or Louise. If you were watching the chats, if there's any additional questions, you could go to the next slide, and I'll let you moderate those questions if there are any.
Thank you so much, Sharon, and thank you, Dr. Steen and Lauren, for all those thorough answers. I don't see any questions that need addressed in the Zoom chat, and I'm wondering if is there any on Facebook, Andrea?
No, nothing has come through either.
Does that mean we answered everyone's questions? Could it be possible? Well, let's be hopeful, and certainly there's tons of information on the city's webpage, which is information that the city's gathered, obviously public health, but there's many links from those pages in the city's website to a lot of other places as well, including the provincial and federal COVID information pages. And I also want to, draw attention to the, let's see, there's 2 extra web pages that are on the city's website that are related to COVID, that are addressing taking care of your mental health. And that's for adults and just the people in the community in general. And then there's a specific page as well that is for families and young people. And I'm just gonna snag that link. Okay, maybe I'm not going to snag it that fast. Okay, I will grab that and put it in there. And oh, I thought I had it open. Well, that's just how it goes. The Your Space website will have the link to this recording, and we'll share it around. And I do want to just pause for a moment and see if anyone that's part of our group had any comments or things to share, follow up, or connect back around before we wind up for today.
Louise, if you could just go one more slide. There is an email address as well. So if you're more comfortable submitting a question by email, or if you are looking for a resource in another language, or you have questions about something related to COVID-19 vaccines, please feel free to email vaccineconfidence@hamilton.ca. And that's an inbox that I look after, and I can help get that information for you, or pass on your email to someone who can get that information for you. And as Louise said, it's not just our resources on our website. We have a lot of great information there, and a lot of translated materials in many, many other languages, put out by both the ministry, the City of Hamilton's vaccine ambassadors, as well as Toronto Public Health has put out a lot of great multilingual resources. So thank you to Lauren and Dr. Steen for joining us tonight. And if anyone else has anything to say.
I think we do have one more thing. There is a question that has come in, and this one would be for you, Dr. Steen. Is it okay for kids with epilepsy to get the vaccine? Are there any implications or things that that they should be aware of?
Sorry, I have to unmute. I was talking and I was muted. Epilepsy is not a contraindication to getting the vaccine. Like in any seizure disorder is actually not a contraindication to getting the vaccine. So I'm not. There's no precautions or extra steps that we would take for someone who has epilepsy. They would be monitored for the same amount of time afterward, for 30 minutes, and then be able to go home.
Okay. All right. Thank you very much for that response. And I do hope that addressed the question. And if there's any others, as Sharon said, there's the email there, and we'll make sure that information is shared out as well afterwards. And let's see, is there anything else there? Thank you for you there, Dr. Steen. And let's see. Oh, I found the cities. Not that I just had it bookmarked and it was buried. There's the link to the Child, Youth, and Family Mental Health During COVID page, and lots of great suggestions there. And just to remind people as well that if you do feel like you need to talk to someone, there are a number of different places to go, and there's information from that page that you can follow to get to that information, including a virtual walk-in for children, youth, and families that is part of Child and Adolescent Services. Lauren, you'd probably be able to speak to that a little bit if that's helpful, and if you'd like to, feel free to. Not to put you on the spot or anything. Go ahead.
Yeah, no problem. Yeah. So Child and Adolescent Services is a publicly funded mental health clinic for youth. And we have a new updated website through the city that allows us to have virtual walk-ins. So if you would like to refer yourself, or if you are a parent who'd like to refer your child, you can find that on the webpage. You submit a self-referral, give us a little bit of info, and we'll get back to you and book you for a virtual walk-in. It's a one-time appointment with a clinician, so a therapist just like me, someone on our team, and they can chat with you with and deal with whatever is kind of challenging you at that time, and talk about potential services or referrals that might be helpful.
That's terrific. Thank you so much, Lauren. And if you happen to be watching this recording or watching the live stream and you're not in the Hamilton area, definitely take a look at your area's public health pages. I think probably most areas have that mental health information, or contact your local PCMH group if you've got one near you. I think what I should probably do now is, if it's okay, Haruka, would you be able to advance the slide? Perfect. If we get to our final thank you slide, and part of that thank you, I didn't mention at the beginning that we do have Andrea Tagalakis with us tonight from PCMH, which is the family support program that's part of Children's Mental Health Ontario, and it's PCMH's Zoom and PCMH's Facebook, and that we're using. And Andrea, if you want to pop on and say a little bit about other resources at the provincial level that people could connect to, that would be great.
Sure. So the website that I had shared, the Kids Health First .ca, that's a resource that was done in conjunction with CMHO and other community partners, including Sick Kids, with resources on vaccines. And as Louise had mentioned, if there's any challenges that you're experiencing and your child is experiencing with regards to mental health, please do reach out either through Facebook or our website, family.cmho.org. And we will be happy to direct you to a local peer support group or refer you to other resources that would be more appropriate. So we're here to help. Thank you.
I forgot I was muted. Thank you so much, Andrea. And there's the link to PCMH's webpage at the Family Care Center. Lots of other information there as well. And does that feel like everything? Anything else we're missing?
No, I think that's great. Thanks so much. Thanks for hosting.
Well, thank you all so much. Really appreciate having this chance to share this information out to young people and families in the Hamilton area and wherever else that you may be watching from. And I know there's one more website that I think I would like to just pop in the chat, but we'll make sure that there's links on our resource page to all the other stuff. This one in particular is youth resources at, here we go, jack.org, all related to COVID. I just wanted to balance that out with the youth side as well. So we went a little bit over time, but we had a bit of a bumpy start, and I just want to say thank you to everyone for weathering that particular storm. And we really hope that you all do take care, and look forward to connecting at some point in the future.
Thank you, everybody.
Thanks, Jen. And thank you, Haruka, as well, for sharing your